So yeah, it brings what my problem
It's
is.
okay. It's okay. I
The
listen. I
accusation
listen.
is just my
That makes
husband beat
sense.
me up. But by the time we begin to dig into the matter, we discover that the men sometimes get frustrated with the accusations and the quarrels and the nagging and sometimes the hitting too. Women also hit them, you know. So the challenge for me as an investigation officer has been that people are not coming out to really say what their problem is.
Please, where's
If
your
I
phone?
know that my problem is the
Come
fact
online.
that
I want to be just be observing what's going on
contacted
online for you.
HIV, for instance, what I
See for
expect
you. If you're live in
myself to do
19
is to
hours,
seek
why?
for help and not to begin to attack my partner. So in the women and children department, this has been the issue. And then sometimes it takes us,
Click on
you know,
community. Place
like
community.
months to unravel the
Okay.
issues, you know. It takes us months. People are not willing to come out to say this is what my problem is. And because of that, they can't get help easily. There was a conference that the commission did in collaboration with the Network of African National Human Rights Institute, and with, in attendance, um, MSM. I'm sure we all know what MSM is. Yes, the key population. We had them in attendance, and some of them were also going to go forward if people are discriminating against themselves. You know, so these are the challenges that we have noticed as a commission that people are not willing to say things the way they are so they can get help. Thank you.
Thank you very much for this quite exposing facts as we are getting them. And thank you for appreciating. I think Saka should also talk about what, because we know Lagos State has actually been the forefront. They are very
Response team was inaugurated in the States, and we had all relevant stakeholders present at the inauguration. So this has actually helped even before now. I know that in the response, a multi-sectoral approach is pertinent in achieving everything we need to achieve. So we've been collaborating with all MDAs, Ministry Department and agencies, like the Ministry of Women and Poverty Alleviation, Ministry of Youth and Social Development. We also work with law enforcement agencies, like we have the Police Action Committee on AIDS. We work with the Ministry of Justice. We work with the Domestic and Sexual Violence Agency and all that. When we have gender and human rights issues, we all know that stigma and discrimination is one of the major drivers of HIV presently. So what we have done as an agency, for example, we have actually built the capacity of human resource managers of private organizations to actually let them know the existence of certain laws in the state, like the anti-stigma law that was enacted in 2007, and also the workplace policy that was enacted in 2013 that protects the rights of people living with HIV at the workspace. Also, apart from this, we have also built the capacity working with different places and networks like Action, NEP1. We have built capacities, we have provided grants and equipment people that are actually that are like tend to be not to be equal to men. So this has been important too. Apart from that, we have also practiced inclusivity in our HIV program by trying to include marginalized individuals like the visually and hearing impaired community in our HIV program. So what we have done is we have sensitized them on HIV, and we're also the first and only state in the federation
television to actually print IV material for free so that the visually impaired can have materials on HIV prevention. Apart from this, we have also sensitized because we know that the communities, key opinion leaders are very important in helping to actually take down messages as related to HIV-related stigma and discrimination. So we have sensitized a lot of religious leaders, key opinion leaders in the community, so as to reduce HIV-related stigma and discrimination. Then when we have cases of HIV-related stigma and discrimination and human rights cases being reported, we've synergized with all FDA. Like there's some cases that were reported recently, which we are addressing. We have written to the parties concerned. One is on a case that someone that was employed and had to told to quit his employment because of the HIV status. We are taking that up presently. We've written to all parties involved, and we're going to have a mediation meeting to come to an amicable resolution of this at the end of the day. So when we have such cases, we call everyone on board and then we meet as an agency to actually deliberate on these issues. We also have a human rights and justice work group that also helps in addressing some of the issues we have as related to gender and human rights. Thank you.
Thank you very much. We want to come to the community to get a kind of a feedback from some of these opportunities that have been laid there. I know through the support of some of the interventions that we got from UN system, GF, we have over 400 cases of violations of rights reported, various degrees and levels. And I want the community to talk a bit about their experiences. And Dr. Iwande also spoke about community rights champions. How are they coming on? Where are the gaps? What are the opportunities we can lash on to improve, to strengthen the gender and human rights responsiveness for HIV prevention and invariably HIV response? Ebere, you want to take the shot?
Good afternoon, everyone. My name is Ebere Nogune. I'm representing Association of Positive Youth Living with HIV and AIDS in Nigeria. So, coming to sharing experiences of young people or people living with HIV regarding gender and human rights, it has not been an easy thing. It has not been an easy thing. The other time we had so many experiences, and I'm going to share at least only two. One one was one of our in my own support group. That's our support group member because of his HIV status, the work, the opportunity that was given to him was retrieved back. Why? Because he's HIV positive. And so many denial, a lot of things are happening to HIV positive persons, of which we are going to discuss all of them today. So when we move into action, though there was justice, his own rights. And on this, we have been doing sensitization of on patient literacy, on Anti-Discrimination Act, so that many people living with HIV, adolescents and young people, will know their rights. And they will also know that the Anti-Discrimination Act did not only safeguard the dignity of people living with HIV, it can also be against people living with HIV when you, as a person living with HIV, violate other person's rights. So another experience I'm going to share was a young girl. Someone DM'd me and she perpetrated me that there's this young girl in their community that she has been, the uncle has been sexually molesting her since she was 8 years to when she was 19. She was 19 that last year. So, and this girl, at least she has started having so much psychological issues based on that because of what she has been experiencing at home. So I now took up the case. I invited the girl. The young girl came. She just finished writing her O level. What happened? She said from the day one she moved into her auntie's house when she was 8, she had her diary. She's a smart girl. She has a diary where she put down everything dated. She will put the date and narrate how it happened. So it happened that since she was 8 years old, the uncle having sex with her continuously till when she was 19. So what let the cat out was when the auntie was planning to travel. So the mom was telling her, you have to be warming up. Just be warming up because once your auntie travel, you have to give it to me back to back. However I want it, I'm gonna get it. So this now brought fear into the life of that girl. She started seeking for solutions. She went to a pharmacy and lay a complaint. The pharmaceutical person reported to the person that brought it to me. It was actually a third party that brought it to me. So when I took the case up, we took the girl to we took the case to NAPTIP. So NAPTIP handled the case. They ensured that they so these are the things we have experienced: the stigma and discrimination, HIV positive people place, both HIV positive, everybody would be out of where you are. One of us once shared her story how, because of her HIV status, own parents, her own parents had to lock her in a cage, something like a cage. If they want to give her food, they will pass through the food through under the cage for her to carry the food. And as God may have it, now she's one of the champions we have. She's now working with NACA, National Agency for the Control of AIDS. So that's a good fight. So the patient community will pass through a lot regarding gender-based violence, regarding access to sexual and reproductive health and rights. Is it when you go to the facility as a person living with HIV? There was a time we actually decided to go to most of the facilities to know what is happening. We visited the facility, and it happened that one of the staffs there always abused people living with HIV. Her own was worse among all the facilities in this FCT. What did we do? We now planned to go and meet the medical director of that particular hospital. I don't want to mention the name. The day we went to meet the medical director, based on the nonchalant attitude of that healthcare worker over people living with HIV, the man confided in us that that particular week we lost two people, two persons living with HIV. We lost them. Why? Because of this nonchalant attitude. A pregnant woman came. I beg me, I no go attend to her. She said, I beg, una leave me. And you watched her died. We lost two persons, but he pleaded with us that he will ensure that all those things will be corrected. We shedded tears. We shedded tears. Yes, we shedded tears. How somebody would lose her life because she's living with HIV. she's HIV positive because she comes to the facility to assess treatment. You say, oh, she's HIV, abeg me, I no go, abeg go. It's my time to go, abeg, I don't dey go. You know, that kind of thing. And so many of them. So let me just end it now here. Thank you very much.
You, I think you want to add yours because we feel community acting as linkages to services, also to link up to other institutions to collaborate to ensure people get access to justice. They are also watchdogs, and these are areas that we have actually benefited a lot from collaborating with the community. Our KP community, any additional thoughts and ideas on how some of these issues you have been able to innovatively resolve them within the community and working with others?
All right, thank you very much. Good afternoon, everybody. My name is Raphael Oyeni, and I'm representing the KP Secretariat. And the previous speaker, panelist, she made a very vital point about the injustice that people are facing, people living with HIV. And I'm not trying to split facts, but I could say that we, the key populations, are facing even similar issues, even greater, more than what people living with HIV are facing, women and girls. And first, I would like to try something in the room. If you are representing the KP, can you raise it's part of what we are saying. We have low representation of key populations in every sector. We it's even getting better now. I think 3 years from now or 4 years back, a KP person cannot come here and speak. Our voices are not being heard. We can't come out to say, "Oh, I am an MSM person," or "I'm a sex worker," or "I am a period." We cannot boldly come out to talk about ourselves. But we are grateful for opportunities like this where we can also show ourselves and also talk about our issues. And sometimes I know people do say that it's better to hear from the horse mouth. And I actually do believe that because no one can tell your story more than yourself. You are the one that know what you are facing. You are the one that understand the deep critical issues that you are facing. And I would also like to talk about because the key populations are split into different handles. And first we have the MSM, which most of us know, men with people men. Then we have sex workers, and then we have period. And looking at all these things, we realize that there are intersection of gender and human rights abuse that we faced. For example, we've looked at where if I have access health services today and I was being discriminated, the next day I will tell other students, "Oh, don't go to that facility. They discriminated against me. Don't go there." And those people effects affect why key populations don't try to access healthcare services. And your feedback is what I'm going to take to the KP Secretariat too, that we could integrate how maybe key populations can go back to access healthcare services. And one more point before I round up. So I understand that our voices are not being clearly understood, and I will base it to the society. Now, there's a perceived societal stigma and discrimination that key populations person are facing. Let's look at, and we understand that healthcare people they have this ethical procedure where they have to treat everybody equal, everybody is equal. But let's not forget that these people grew up from a home where you hear that, "Oh, don't sleep with men. Why are you transacting sex? Why are you a sex worker?" From this home. This has formed their formative age over the years before they became healthcare workers. They have this notion in their head that these people are not they are not doing something right within the society. And I thought it's going to affect them in a way because you know You can't predict how somebody will react. We can say, okay, these people, I have to do my job, I have to do my job. But you would see from them that they are not 100% doing their job. And one way we can curb this thing is using our traditional media. If you go to social media, I could open 10 different sites about key population. And what you'll find there is 8 comments. You could open 10,000 comments and you will not even find one single good comment about us. And these are the issues because these healthcare workers are seeing this thing. They believe that if the society does not accept you, why will I accept you? Let's forget about ethical procedures or what they are meant to do as the healthcare workers, or as I pass the right message. Let's sensitize our media. Let's give them accurate information. Let's call people by their pronouns. If somebody tell you that I'm not he, I'm she, let's accept it. Let's not try to fight. Let's call back the innate behavior of us to say, why are you a she? I'm seeing physical structure. Why are you this? Or let's look at sex work, how you are telling. Okay, let's try something. We all know that sex work is the oldest profession. No one can dispute that. And we cannot say, okay, and yet we still discriminate this set of people. Or MSM, where they said it's a Western behavior. Yes, we see in different cultures where we have instances of people getting married to themselves for procreation issues. And yet, we keep saying it's a Western culture. So I think what we can do is to strengthen the media. Let the media pass the right information. Let's call a spade a spade. Let's not say it's a shovel. I think I'll stop here. Thank you, friends.
Thank you for these interventions. I think at this junction, we've seen what the system is trying to do. We have seen the community talking about this and the challenges that are being faced by community members. And I also would talk for a bit to expand on discrimination being faced, not only HIV. The issue of inclusion was actually raised. That inclusion is a critical element of everyone's rights, and that the programs we also still struggle to reach people with disabilities. We have translator there. We are unable to get someone to share experience at this, but we know some of the experiences we are having, they also at different level of engagement. They are part of TWG. They show, they express all these discriminatory practices has been experienced by people with disabilities. So we will throw the floor open for input, for comments, for clarification. But we have noted also that some of the challenges are being faced, as being faced, there are also structures in place to mitigate against them, to address them, to also continue to improve on our system. But one thing that has come up strongly, especially around KP programming, is the issue about societal agreements and moral standards as being set up by the society. We have also seen we have used gatekeepers, how some of the interventions at the lower levels are using gatekeepers to bridge that gap. That's an innovation, that's a useful strategy that I think we can deploy to actually empower people more around gender and human rights related issues. Do we have comments from the floor? Yes. We will need to manage this. I can see 6, 7 hands up, and we have about 10, 15 minutes to finish this session. So I think we need a timer, Dr. Yewande. So we will be doing 1 minute or maximum 2 minutes. So on this side, where are the hands? Okay, I can see, I want young people's voice first. I can see you in 3. Yes, this young people's conference. No, no, we will come to the elders. 1, 2, 3, 4, and 5. No, we will come to this side. Okay. Number 1.
Good afternoon, everyone. Okay.
Okay, we are talking about trying to end it.
Please increase the volume. Borrow mine.
Am I being heard like this? Okay, we are talking about completely stopping AIDS in Nigeria, but still, most of the time, especially in all these one-stop shops, we find it quite hard to access protective materials. I am a sex worker, a queer sex worker. And most times, okay, my organization currently did a research funded by ISDAL on mental health challenges being faced by GBTQ sex workers living in Southwest. We focused on Lagos. And during the time we were having a focus group discussion, we were hearing most of these reports of how our community members get discouraged from trying to access further care due to the discrimination we face, especially at all these one-stop shops. There was a time I was actually called to pick up some protective materials, and on getting back to my offices, I got to find out that those things are expired, and those things were in possession of these OSS. They didn't give it out. Only when I went there and they were like, "Oh, you have to pack this because your people need it." And on getting back, these things are expired. Most of the time, we can't even go back to make refill for our PrEP, which is supposed to prevent the spread of HIV. Most times they have these condoms, they don't give it out. So it is one of the challenges that we face, and I think it should be looked into.
Thank
Because
you.
especially our members will go to some OSS, and you find most of the people there giving us flyers like go to church, go and get deliverance or something like that. These are stuff that discourage us.
Okay, thank you. Noted. Number two.
Good afternoon, everybody. Naked Abiko from Avix Project Lagos. So I want to talk around discrimination, self-stigmatization. Like my project during the COVID era, we tried to make drugs available to our beneficiaries in the community, and I found out that a lot of persons are self-stigmatized, not as a result of stigmatization from external forces, but from themselves within. I saw beneficiaries coming to us with sacks, as in sacks for rice, to collect a bottle of medication, so that people will not think, because they believe that if people see these drugs with me, they are going to know that I'm HIV positive and I'm on drugs. So, I just see that people are self stigmatized, they have bottled themselves up, they have caged themselves up. Again, around KP, I happen to be the focal person for KP organization. We have a particular beneficiary, trans woman, who complained to us during one of our empowerment programs and said, in the community, in the society where he lives, other men are like, let's know if you are truly a woman who wants to have sex with you, and this has been a constant thing around some communities in Lagos. They want like they keep harassing them sexually. That since you said you're a woman, I want to have sex with you. I want to see if you're truly a woman. So I don't really know. I think we should go back to different organizations and carry out more sensitization, and we should give these people an opportunity. They are humans like us too. Thank you.
Thank you. Number three.
Hi, good afternoon, everyone. I don't know if I can be heard. Well, yeah, the mic is coming. So, my comment will be around some aspects of the presentation regarding some policy documents that are available, right? And a long list of them. Now, many of these policy documents are available at national level. At most states have these documents, but are not domesticated. If we go to the look at the Anti-Discriminatory Act, how many states of the federation have domesticated these laws? And if they have not been domesticated at the state level, how do they utilize this law at state level to advocate and also to make litigations where necessary, right? So most of these laws are just not rightly disseminated and may not even be also interpreted in the local languages. There is nothing bad in having it in Igbo, Hausa, and Yoruba, right, to drive the message home to the end users, right? So these policy documents, can it get further from the state to the local government? Can it get further disseminated at the grassroots level? Can it be interpreted in other local languages, Nigerian languages? Right, that's one. Then two, my comment, second comment will be on aligning all of these our thoughts with Federal Ministry of Women Affairs, right? How are we really integrating with the Federal Ministry of Women Affairs? I was hoping that one of the panelists here would be from that ministry because there will be a lot of discussions from here that they also need to act on, that they also need to implement, you know. So I would want to see that in maybe subsequent meetings like this. Thank you.
Thank you. Number 4.
Um,
Okay.
yes, so good afternoon, everyone. Thank you so much, the panelists. Um, I want to agree that we're doing so much in this area of discussing today the issue of gender and human rights. But I have some concern, and that is the area that has to do with the reporting. Yes, for those who have been implementing these projects of something that's to do with gender and human rights and gender-based value and human rights, fine. We shall implement it. But for those of us who are not implementing, at times I know that I was writing a concept at the point, working on it at the point. I was searching for some national data on gender and human rights issues. It was difficult for me to get this what I wanted. So I think we need to also, as we do this work, let's try to ensure that this information, the data or the information is disseminated to the subnational level so that people actually know what is happening out there. For example, like I've been engaging with IPs and issues on human rights issues and gender based on this and this. So yes, I don't have I don't have it. So please let's try to document. Yes, not a report, we are working to verify. Yes, but put it out in the space for those of us who want to fix it and also use it. You know, in MI, they said if it's not documented, it's not done. Then I know that currently there's a lot. Okay, the other issue is to continue that community engagement. I know we're also working with the Ministry of Health, Ministry of Women Affairs, and others. Is let's the current body is supporting what is going on, but I think it's important to ensure that we strengthen the structures. Even when those projects are no longer there, they will keep doing the work for sustainability. Thank you very much.
Yeah, so that will be fine. I'll see if I can speak for her too. Um, okay, thank you very much to you, my dear organizers, and everybody. So my intervention would be quick charge to the community, the community, and the other communities. So you see that those of us who are Christians, and apologies to every other person, you know, Moses said, "A prophet will the Lord raise for you amongst you." So I think that as far as discrimination and gender-based violence goes, and the other issues, the KP community will need to rise up to find that solution from within. A couple of years ago, nobody would touch KP work with a long stick, but Heartland Alliance, for instance, stepped up and we said we could do that. So imagine that you are the head clinician in a facility, right? Steps up, discriminate. You said, no, I'm a KP member and I'm the head of this hospital, right? So we need to move away from that place of vulnerability, right, and own it as a community. And I don't think we have done well in that regard. It's always we versus them. How about we become the them, right? Because many years ago, most of us stopped politics, and we see that today the worst of us in quoting are ruling the best of us. So I think we need to do that too with intervention for that community.
Thank you. 6 there.
Good day, everyone. Good day, everyone. I love what my brother has said. To speak for me, but the truth remains that, according to him, let us be. But we have a lot of challenges here as regards to representation, our representation in program designs, dialogues. If we are being carried along during the program designs, we will be there. But making decisions on our behalf and giving out those implementations to us to implement is where the challenges comes in. It's a very big challenge for us. I'm a sex worker from the Nigerian Sex Workers Association, and I'm a member of the National Steering Committee. So you can't just call me in and give me fields, go to the field, work. This is your target. Without carrying me along in your program design. I might go there, come back with false results, which you don't know where it's coming from. For the fact you've given me time. But if I'm there during the program design, we should put heads together and come with what works best. Thank you.
Thank you. On this side, can we see the answer? Oh, we have 2 questions. Okay. There are a bit of contribution, but let's quickly take them just so and then we'll still manage the time. 1 minute. Can I see the hands, please? 1, 2, note your number. 3, 4, 5, 6, 7, 8, 9, 10. 1 minute, please, Dr. Yohande.
Right. All right. Thank you very much to the presenters. That was very. Sorry, can you hear me? Can you hear me, please?
Yeah.
All right. Thank you very much to the presenters. So very quickly, I just wanted to ask. I think someone mentioned about MSMs not accessing services at the hospital, and I was just wondering, even though there's that self-discrimination, how about the laws that actually protect them? Because we know in Nigeria, the law really does not favor these people. That's one. Secondly, I wanted to find out about like is there any support talking about psychological issues that people are experiencing? Do we have any support for mental health? In all of these interventions, because that way it can help address some of the barriers to services and other issues that they may be facing. Then I wanted to ask the guys there.
KP Secretariat.
Yeah, when you were talking, you didn't really mention people in congregate settings, and I was wondering why you are not like we're talking about inclusivity. You didn't really include them in your conversation. So I'm wondering, is it that they're not necessarily part of the KPs, or how are they accessing services?
Thank you. 2.
Well, thank you very much. I just want to share this experience and then to drive home the point.
Summary.
Ma?
I said summarize that in
Yes,
1 minute.
yes. The patient was on the bed, had already, been booked for surgery, and then upon doing the HIV test, was found to be positive, and the doctor said now he would have to pay for 200,000, he have to pay 400,000 if that operation must go on. So in my state, we have domesticated the anti-discrimination law. That was done in 2021, but it's the Ocean State. But I just got into the HIV space in October. Now what we want to do is get support to disseminate this anti-discrimination law. Because if people know that if you do such against someone that is positive, you are likely to be heavily penalized, the people will, desist. But we know that many states have actually not been quite responsive in, budgeting for HIV prevention activities or, HIV response, activities in their states. So we need high-level advocacy, from NACA, joint together with the SACAs, to ensure that we reach to the state governors, to the houses of assembly, to ensure that HIV is given priority in their budget. Thank you.
Okay. Number three. Mine just is the interest in terms of the reporting for the youth group. She did mention that the fact that when there was an incident, we went to a pharmacy and I wonder whether they have a reporting system that seems to highlight those pathways and build upon them. So I will encourage any group at all, if there are gaps. I know she mentioned earlier that the issue of the investigation is important. So there will be one person or one group that you always report to. If we begin to identify such communities, if we begin to have religious structures within the community, it will not actually improve it in the research for such incidences. That's the thing. Okay.
Hello, can you hear me? Okay, so mine is a question to the Human Rights Commission officer, and I'm just trying to find out if there's any punitive action that can be taken against a parent or caregiver who refuses give ARV to an HIV infected child. We all know that health is the right of all Nigerians. So why will somebody deliberately do this, even though the drugs are not able to cure? Anything like that, how do we do that?
Okay. Oh. Yes, I think I'm fine. So I want to comment on the presentation made by Dr. Yewande, and it's very exciting to see all the work that has been done in the past. But I'm wondering if there's any plan in the near future to synergize the new things happening around the gender world, in terms of reviewing the SOPs that I think the last time it was in 2019. Correct me if I'm wrong. Then the other thing the other person I want to is Madam Mercy. She makes some comments about having protection, something for children and women and children in National Human Rights Commission. This is something I'm very glad to learn that, and I know that we'll be looking for such avenues that we can refer people that have such needs. So thank you for that. Then for the KP Secretariat, I always have a word of encouragement or caution for the KP community. It's self-preservation. I think that the KP community should train their members for self-preservation. What I mean by that, you need to protect yourself. For example, I go to a place and my KP people are calling me on phone that police arrested them. You go to a hotel, you are having a party, and then you are having sex in a room, and you are shouting, drawing the attention of people around them. There's no how the law will not be against you. So the KP community should train their people to preserve themselves first before they will now start giving the society the responsibility to preserve them. So that's my word of caution for the KP community. Thank you.
What I'm trying to say is that the leadership of the KP should draw code of conduct and character for their members. I have cordial relationship with them in my state, and the issue of Imo Saka. Now, the issue is that most of the time, the stigmatization around them by the society, they trigger it. How can you, as a sex worker, you have a client, you have your bidding, you have the agreement, after that you aim at either drugging your client and carrying away the portfolio or the rest of them. Every time when you go to the police, you see such reports. And that is where the police is on to raid on them. Then apart from that, if they are dressing, you must still dress to plant yourself for people to know that please dress cordially. When you dress cordially, anybody who still knows you're in the business will call you. I'm not trying to dress to the extent that you know an eyesore or you are spotted out immediately as dressing negatively and the society now focuses red eyes on you. So some of those characters, so there should be ethics and a code of conduct drafted by the leadership, so that just like the self-preservation, you can do your thing neatly. Even the peewits, you see them wherever they go, most of them, they carry the weeds in their bags and they carry their instrument in their bags, and any police raid unconsciously in a car or in a, you see them. And you say, they will say they didn't know that, or that they were, strung up, or, something like that. So I think that is where the job is. They should try to preserve their community and guide them, and they should do their thing. We are not judging them, because what we're after is the HIV prevention component of their, health and
Thank
society.
you, sir. Thank you, sir. 7. Yeah, talk.
All right. So mine is just a request, and that request is necessitated by what somebody already talked about. So recall that NACA is planning to support the revision of SSP, State Strategic Plan for States. And one of the things that triggered that is because of the inequalities that came up from the PD and gas, that is political declaration and global health strategies. And those issues that stand out there are issues of gender and human rights. So the same way NACA is making effort to support revision of state strategic plan, they should equally support states at least to domesticate the anti-stigma law for those who have not domesticated, because I know a good number of states have not done so. So that is a request I want to make. Over.
Thank you.
Thank you.
Number 8.
Thank you very much. Everyone seated here. My concern is the um, the students in secondary schools concerning FLHC slash gender-based violence teaching in schools. Taking, for example, the scenario painted by my sister seated up here, that a young girl has been violated for some time and she refused to speak out. Now, if gender-based issues are incorporated in our school curriculum, and the pupils of secondary school or primary school that are well equipped, I'm very sure that such girl will always want to speak out, so that at the end of the day, she will be let out of the hook by an uncle. So let the NACA and Federal Ministry of Education build in gender-based issues in their school curriculum, so that they will be well equipped. And if you look at the FLHC now, it's no longer FLHC, it's, they call it a reproductive subject. And looking at that curriculum, you find out that the curriculum is not really talking about the reproductive health. So, likewise, let Ministry of Health, Federal Ministry of Education, and the NACA come up with a school curriculum with web-based and well-equipped with a gender-based, so that the pupils, the secondary schools, they will know their rights, so that they quickly speak out, and there will be such acts will be not at the. Thank you very much. So that is my submission. Thank you.
8.
Number 9. Number
9.
9.
Number 9.
Number 9. Thank you. I'm on the floor.
Yes.
The last person, are you still here?
Thank you very much once again. My name is Emmanuel Anene. It will be good to note that the Depopulation Secretariat does not support any form of amoral display in the public places by key population members. Secondly, I remember vividly we used to have prevention and treatment, unlike the order of the day today, where we have more focus on treatment. So I also remember that sexual gender-based violence is inclusive of it's some part of prevention of HIV. Then again, I also want to say that the period where we used to have some sort of cohort section during the field activities, we used to have a lot of sensitizations among the key population community. But currently, the reverse is the case, because currently what we do, community members are more focusing attention on treatment because of the high level of targets given to them. So I will also suggest to our partners, if there is any form of probably having other ideas or ideologies going back towards prevention. When I say prevention for key population intervention, I'm talking of having 8 or 10 or 12 cohort community members having conversation on a particular topic, even if it's once in a week or twice in a month, that will go a long way. Also, it's important to focus attention on media. Most messages passed out by media on key populations is not really favorable for the key population community. Thank you.
Thank you very much. I think in rounding up this session, I know another session is starting soon. There have been lessons that we have all learned. There have been contributions, there have been inputs that I know are innovative, that the response can take forward towards any age like 2030. But we have some questions, which I think some members of the panel will just respond succinctly to those questions. Majority of the issues are comments to take into consideration as we look for innovative way of resolving this. But I'm also happy that so many of the people around the table are members of one TWG or the other. And those TWGs, we are going to strengthen them the more, such that those ideas can come in to organically change the trend of the negative things we currently have. So, our barrister, you have 1 or 2 questions to respond to?
Yes, the first question to me was about the laws that protect. Okay, so the question directed at me was the challenges. So I focused more on the challenges, which was why I said some of them discriminate against themselves, they stigmatize themselves, so they are not able to come out. If you ask questions about the National Human Rights Commission, all complaints are admissible as far as we're concerned. But when we receive the complaint, sometimes we refer. When we see that doesn't fall within our mandate, we refer. So we do lots of referrals. And this also answers my sister who asked about what we do to caregivers who refuse to administer drugs if she's busy with someone. We do referrals. Anything we can't handle directly because we don't have detention centers. So we refer when we have to refer, but we admit first. It's assigned to an officer who goes through it, and then we call the complainant and tell them, okay, your complaint has been, it's admissible, yes, but we can't handle it because it doesn't fall within our mandate. Okay, so I focus more on the challenges because that was the question that was asked. So the challenge is that some people are not even willing to come out to get help most of the time. I'm sorry, can I say something briefly about the sex worker thing? I have been privileged to attend some of the meetings. Can I? Okay, I've been privileged to attend some of their meetings, and I am aware of some of the challenges that they face. But we had one of the meetings I attended in Kudu. The ex sex workers who were in attendance also gave some advices to the current ones, the ones who are still in the business, right? What she said, which I took away, is, and that is why I can talk about it here. She said, because the ones in Kano who came into Abuja for the program complained that about their dressing, like when they are dressed going out, the Hausa boys are throwing stones at them and all. And she told them that, and I'm saying this might help you, maybe you take it away too. She told them that no, when you're with the Romans, you behave like them. So when you're going out for your business, dress properly, dress like the Hausas, the Northerners, how they will want to see you appear. Dress like that. Then when you get to your business arena, you can now remove those flowing gowns. And then she even gave them, told them that she used to make so much money, from dressing like them. So it is not when you are in a particular environment, you dress like them. Then when you get to where you're going to, you can pull up whatever you want to that. That is what she said. I didn't say it anyway. I just took it away.
Thank you very much. Like I said, it's a work that is coming up. And I think some of those things, if they have the ethical quotes has been advised, would also help us strengthen what is being done. We have comments online. Yeah, we want to take 1 or 2, 3 comments online.
Good afternoon. I'll just read out the questions. We have a first question from Rubinu Hope. She said, is it possible to have an HIV club in schools so that there will be awareness? During my secondary school days, we had one. Okay.
That's a yes question. They also exist, but we need to strengthen them. Any other question?
Yes, there are other questions. Loretta Ekanem said, do we have a directory of services provided for referrals?
Yes, we do by state. It's also going to, I think we have one on NACA website, but we will update it and continue to share online. Check what NACA website for those materials.
Uche Brown Egbe, how do we effectively engage religious leaders on HIV prevention and gender-based violence? Uche from Ewek, Kaduna.
Okay, that already there's a TWG technical working group that works on that. We are also expanding on that in the next presentation. Any other comment? Because we need to close.
Just one more. Patrick Michael Ekanem. He says stigmatization has been what has been making HIV very difficult to control. What can one do to help in all of these in preventing HIV?
Okay, you should join the link and you will get to know more. It depends on the state. There are actually services, groups are available by state so that it's closer to the people, even community at the community level. So you should look out for more information on that on NACA website. Thank you very much. And I think at this junction, we have to close the session. It has been very interactive and rich. Thank you all for your participation.
And below there, sir.
Let's switch this to why do that say? Let's switch this to.
get direct from your.
Before they start because I have to start the next one. Because I'm just everything is
What's
just
this
messed
one?
up.
What's
This
this
one is
one
my
working?
audio taken out. It's not even working.
Out. Go back to the settings. Let's see.